3rd, 2021. Sego, David Lahashiu Juts, and welcome to another edition of the COVID-19 Task Force Update on this our 193rd edition of Kahnawà 911. On today's program, we'll hear from Shooter Dailleboust. He's a registered nurse over at the KMHC and also a survivor of the COVID-19 virus. Last year, Shooter had some health issues related to the virus, and he'll be sharing some of those experiences with us. And we'll also be hearing from Lisa Westaway, the Executive Director of the KMHC. And without any further ado, here is our first guest, Shooter Dailleboust. Shooter?
Yeah. Good afternoon. They asked me to come in today to speak about my personal experience of having COVID. It was actually 1 year ago today that I woke up at 4 a.m. feeling like crap. I had a fever, body aches, intense headache, and I knew something was up because a few of my colleagues at the hospital had already had COVID. They got tested and were positive. So I immediately went into isolation, called to go get COVID tested. I had to drive myself all the way to St. Jean, feeling horribly. It wasn't fun. Afterwards, I had, for 8 days, my symptoms got progressively worse. I had a headache like I've never had a headache in my life. At one point, I thought I was going to have a stroke, how bad my head was pounding and the pressure on my brain. Body aches were like I got hit by a train. It was the worst I've ever felt in my life. And the fever that just would not go away, no matter how much Tylenol I took, it just wouldn't go away. The first 5 days were just headache, body aches, fever. The 6th day, I started having trouble breathing. And it got progressively worse to the point where I told my wife on the 6th night, I said, if it gets any worse, I'm going to have to go to emergency. That's how bad it was getting. Luckily for me, I only had one lung that was affected and not both lungs. Because if I had both lungs affected, for sure I would have been in the hospital and probably intubated, and who knows the results after that. So the 6th day, I started having trouble breathing. I started doing a lot of deep breathing exercises, and I think that's what kind of saved me. The next day, I started feeling a little bit better. Still had trouble breathing, but not as much. And then the 8th day, my trouble breathing went away, and then the 9th day I woke up and all my symptoms were gone. But I still had lingering effects for 3-4 months afterwards, where I had numbness on my right arm, right leg, and a few other things that kind of weren't right. My brain was a little foggy at times, and just something wasn't right, and you could feel that I was off. My energy levels were low. It took me a good 4 to 6 months to get my energy levels back up to where I could go to the gym and work out and kind of be back to normal. So the reason why I came on today is a lot of people have been reluctant to get their vaccines, which is normal. People are scared. People are misinformed through social media. From my experience working as a nurse, I know how vaccines work. I know that they're safe. I encourage everybody to go out there, get vaccinated, because COVID-19 could kill you. That's the reality of it. No matter how old you are, no matter your race, no matter what, it could kill you. It's a possibility. Go get the vaccine, and hopefully it'll save your life if you do get COVID. That's the message I want to give people today. Get vaccinated for yourself, to protect yourself, so we don't have any fatalities in our community. Thank you very much.
Nyawa Shooter. Up next is Lisa Westaway, Executive Director of the KMHC. Lisa?
Thanks for sharing that with us. I'm going to go a little bit backwards, and I'll get to vaccination shortly. First, I want to give an update regarding the testing site. So as you know, our testing site is still open, and we still have the potential of having COVID-19 cases, and in fact of having outbreaks. We actually have one active case in the community, and we continue to test up to 10 people per day. So there are people with symptoms who are coming through the testing site. I urge you to continue. One thing that we would like to bring forth to the community is a reminder that allergy season has started, and that means that we sometimes can confuse allergy symptoms with COVID-19, especially with changes to the symptom log of runny nose, for example, as a primary symptom of COVID-19. So it's really important that if you have known allergies, that you take your allergy medication every day, and the allergy medication will not mask COVID-19 symptoms. So if you take your allergy pill and you're feeling okay, that's great. If you're taking your allergy pill and you have COVID-related symptoms, that means that you should be tested. We also know that we're still at high risk in the community. It may not seem that way because it's spring and we're out and enjoying ourselves. We don't have very many active cases. We are getting vaccinated. However, our vaccination rates are so low at the present time that we still have a huge amount of risk of contracting COVID-19 and of spreading COVID-19 within the community. Therefore, risk of hospitalization, risk of death. So we have to keep that in mind and maintain all of our measures of distance, hygiene, and masks. So vaccinations. Things went really, really smoothly. We're going really well. And as you know, we've put out a lot of releases asking people to book their vaccines, not to wait. And as was just mentioned by Shooter, we know that it's scary because, again, first of all, the needle is scary. Getting vaccinated just in general is scary. There's a lot of historical and cultural reasons why we might be reticent to get vaccinated. However, it's really important to protect yourselves and protect others. There are, right now, as of tomorrow, we have 77 people booked out of 320 spots available. So we're going to try something a little bit different for tomorrow. We're going to have walk-ins from 12 to 5 tomorrow afternoon. So you don't need to book an appointment. You can just show up with your Medicare card if you're from Kahnawà, from the community, and we will vaccinate you on site without having an appointment. I spoke a little bit about this on K103 Monday, but I just want to give a little bit of stats from a country that has vaccinated fully first and second doses, just to give you a little bit of an idea of what the impact is with respect to eradicating the virus. So Israel, in fact, has their over 60-year-olds are 80% fully vaccinated. And since that, they have 86% fewer cases, 73% fewer critically ill, and 91% fewer deaths. And they're seeing similar declines for all age groups, and in fact their economy is now fully open. This is a result of vaccination. It's really important to be vaccinated because it decreases your chances of getting COVID-19 and of transmitting COVID-19, so of both those things. There are some questions that we receive on a regular basis that I thought maybe I can answer a couple of them here today, and we'll be announcing some measures to answer questions in the coming week as well, live. However, just a few things about actually getting COVID after you've been vaccinated. So after a first dose, it takes 14 to 21 days to develop antibodies. So we're really focusing on that 21-day mark. That's 3 weeks after your first dose where you have antibodies that can protect you. And does that mean that you will no longer ever get COVID? No, it doesn't. You can still get COVID after first dose and after your second dose because the vaccine is not 100% effective against getting COVID-19. So many of you are asking the question, why should I be vaccinated if I could still get COVID? The reason why is because your symptoms will significantly be reduced. That means you will be a lot less sick. So many of the symptoms that Shooter just explained to you, you will not get if you're vaccinated, even if you get COVID-19. We know that COVID-19 will be with us for a long, long time. The goal is to save people's lives. That's what we've been doing for the past year, and the vaccination is just the final step in allowing us to do that. So we know that we can get COVID-19, but can we give it to someone else? So I'm going to go back to some education that we gave to you earlier on in COVID. The less symptoms that we have, the less probability of transmitting to someone else. So just a reminder, asymptomatic people can spread COVID-19, but there's a much lower risk of them spreading COVID-19. So the lower the symptoms you have, the less you can spread to someone else. If you are with a second person who is also vaccinated, their ability to get COVID-19 from you when you have such few symptoms is also reduced drastically. So as you can see, the level of risk that we would have in the community, the more people who are vaccinated, is really reduced quite a bit, so that the more people who are vaccinated, the less symptoms we have when we get COVID, the less chance we have of spreading COVID, and if we do get it, the less chance we have of being very sick. And in fact, the vaccines are demonstrating that we have almost 100% chance of not dying if we get COVID-19 after being vaccinated. There is always risk, and there will always be risk, but the risk is significantly reduced. Some other questions we're receiving: can I be vaccinated if I'm of childbearing age? There is not an impact to fertility. People are asking about short-term side effects. They are much less than what Shooter just described if you do have COVID. So short-term side effects, mostly we're seeing a sore arm, fatigue, flu-like symptoms. They could last from 24 to 72 hours. However, most people are stating that their symptoms are really just a sore arm. But if you have had COVID-19 in the past, you may have a little bit more symptoms after you've been vaccinated. Second dose. We have had some community members who have had their second dose, and their symptoms were not increased at all, although what's documented is that symptoms are a little bit more intense, fatigue, flu-like symptoms after the second dose. However, there's still not no adverse effects. So of all the people who have been vaccinated up till now, there have not been any serious adverse effects in the community. Yes, AstraZeneca did, media has talked a lot about AstraZeneca and about the possibility of blood clots. There has been nothing that has linked the two together. I want to tell a little bit of a story. Somebody in my vaccination meeting, just to put all of this in perspective. Her mom on Wednesday had a stroke. She had been scheduled for her vaccine later in the day, actually at 3 o'clock that afternoon. So if she had had her vaccine prior to her stroke, perhaps people may have tried to make a link between the two. And it would have been important to evaluate the link between the two, because that's what the scientists have to do. That's how we maintain safety over time. We evaluate all impacts to establish whether there is a link between the two. This is something similar that is happening with the blood clots with AstraZeneca vaccine. However, there is no documented link at this time between the two, between the vaccine and the blood clots. We do not have AstraZeneca at our vaccination site. We are vaccinating with Moderna. However, we do have AstraZeneca in the community, and some of our homebound patients have accepted to be vaccinated with AstraZeneca, and they are all doing well. I think those, second dose. So I've mentioned this before. Some people who were vaccinated at the Kahnawà or Valleyfield sites were given a second dose appointment at 84 days. All of those appointments have been cancelled automatically, and you will receive a text message or an email asking you to rebook your second dose at 112 days. There is no decrease in efficacy of the vaccine between day 1, first dose, and day 2, second dose at 112 days. That has been clearly demonstrated by research, science, INSPQ. It's part of the Programme d'Immunisation du Québec, so which is a Quebec protocol that governs all administration of vaccines. There is no decrease in efficacy between day 1 and vaccine dose number 2 at 112 days. We're still hearing comments that not everybody is aware of how to book, how to get their vaccine, about the fact that we have a vaccination campaign ongoing. So we have had we have put together many different measures. We put cards in people's boxes, PO boxes. We've been on the news, radio. However, one thing that we would like to ask is that you promote it. Each of you speak with one of your grandparents or your friends or a family member, and at least have the conversation with them about how to get an appointment. And remember, tomorrow is walk-in, so 12 to 5. We're going to try this out, no appointments. So if you are stressed about having to go on the computer or make an appointment, or you know somebody who is unable to do that, then please come with them, facilitate the process for as many people as possible. I think that's it for the questions for now, but we will be answering questions this week. We're just finalizing the details on one of the noon hour talk shows. And one thing that's really important is that at the vaccination site, there are all nurses that are vaccinating, and they answer a lot of questions, and they are capable of answering with the right information. So please be careful of misinformation on Facebook. Facebook is not necessarily our friend these days, and it can be a great place and a wonderful community, but it can also be a place, unfortunately, where just because we read something, it's not necessarily true. And so the reason why we do these Facebook Lives and we do communication, we have all this communication strategy, is so that we can provide the community with real science-based, accurate information, as we've been doing since day 1. We base all of our decisions on this information, not on misinformation that is spread throughout the community. So please be careful. I just ask that you all really think about where your source of information is coming from. And if you want to book an appointment for a vaccine and come in with your list of questions for the nurses, they will take all the time required to ensure that you're comfortable, and you give your consent in the end. And if you change your mind, you can turn around and walk out, and no one will fault you for that. In the end, this is a decision for you to make, you yourselves, for your own person, for your family, for your community. However, when you make that decision, we just ask that you make it with appropriate science-based information. So, speaking about decision making, the task force last week, as we mentioned, was looking into relaxation of measures. How do we reduce measures in a safe way, especially considering what's vaccination rates in the community right now, and the threat that we have right now with respect to the spread of the virus through variants. So there are many variables that we use in our decision-making process. I'm going to name them because it's important that you know what we look at when we make our decisions. It's not just 1 + 1 = 2. There are many, many different variables that come into play. The first is the number of cases in our surrounding communities. This gives us an idea about the risk level, knowing that our community members do frequent Chateauguay, Mercier, Montreal area. So it's important that we know what's happening in the communities around us and that we understand why numbers are where they're at. We look, of course, at number of active cases in Kahnawà. As I said, right now we have one of those who have chosen to come in and be tested. So we ask the more people that come and get tested, the more we have a good idea of what's happening in the community. We look at the overall number of cases related to variants, because this is going to tell us about a trend, a possible trend with respect to increase in cases, third wave, for example. And we look at those trends in provinces around us as well to better understand how the variants are impacting trends over time. We look at the vaccination rate in Kahnawà, because as I explained to you, the more people who are vaccinated, the less risk that we have within the community, and the easier it is for us to make decisions knowing that there is less risk involved. We look at vaccination rates in our surrounding communities as well. We look at the rate of transmission of the variants and the severity of those cases that are as a result of the variants. And we still look at our ability to identify, contact trace, and isolate people within 24 to 48 hours, because of course that allows us to stop the spread of the virus and contain the virus as much as possible. So with all of these measures and all these variables that we look at, we will be presenting to you on Thursday some modifications in measures, mostly with respect to private outdoor gatherings, recreation, meaning outdoor individual sports, and visitation at KMHC, Turtle Bay Elders Lodge, and ILC. And these measures that we're going to relax on will be most of them will be for people who are currently vaccinated as a first phase. We need to go in phases, and we need to reopen in a way that decreases risk as much as possible. So that means looking at people who are vaccinated as a first step, because we know that there is less risk for people who are vaccinated due to what I had explained just a little bit earlier. So we'll be presenting those details to you over the course of the next 2 days, and we think that it will be a nice way to enter into spring. And again, we urge you to get vaccinated, to listen, or to at least inform yourselves with real accurate information when you're making your decision. Thank you.
Thank you very much, Lisa. And just to reiterate again, we do have our walk-ins available for tomorrow, so please make sure you bring your Medicare card. It's for residents between 12 and 5 p.m. tomorrow at the bingo, where we're having our mass vaccination campaign, of course. Also, our preferred method of booking, if you still haven't booked your vaccine, it is kahnawake911.com/vaccine, and just click on the link. It'll take you right to the Click Santé website. And don't forget, you can also call KMHC at 450-638-3930, extension 2295 or 2206. And we're also still promoting our vaccinations. You can actually just send us your testimonial. You can do it by following the Facebook page on Kahnawake 911. I was about to say FB page. But anyway, you can just follow the Kahnawake 911 Facebook page, and it'll take you right to our messenger, and you can send us your own testimonial. If you need help, by all means, please send us a request, and if we're able to help you, we will be there to help you film your testimonial. And you can also send it via questions@mck.ca. And that's it for today's show. Thank you very much for joining us. A lot of information, and please stay tuned throughout the week. We will be extremely busy this week trying to get more information out to you. So we'll see you again tomorrow. Yawagoa, Danu, Onagiwahi.